I'm a social worker, and right out of graduate school, I had the opportunity to practice in rural Ohio, and one of my first responsibilities was running an aftercare group, which in those days were individuals who were being discharged from the state hospital into the community. This is in the late 70s. And I remember in working with the individuals in that group, how they very much felt at risk. They had been in an institution where, again, they felt they didn't have opportunity to really grow there, and they were excited about being in the community, but again, there were a lot of fears. And I remember asking them the question, what do you need? And it struck me that they didn't answer the question in terms of treatment or in terms of program, but it was in terms of life goals. And invariably, it was a job, a home, and many times I paraphrase it, a date on the weekends, or connectedness, or social relationships. And it told me that we had a lot to do and learn in the mental health arena. And when I saw the hope you could instill and the strength people can find within themselves, it really motivated me to really pursue a career where throughout my career, and I've been blessed to be a provider, to manage services, to be at the state level in policy and the federal level, the fact of being focused on people with serious mental illnesses and addictive disorders became a very much a private personal mission for me that I was able to translate into more of a public mission. There's no doubt that as a community made up of a range, and we need a range of disciplines, a range of individuals, a range of expertise. We have researchers, we have providers, we have policymakers, we have those that purchase services, and we have peers, and we have advocates and families. And each one contributes, and where I think we gain by functioning as a community is we can leverage each other's knowledge and experience. I think innovation only comes through collaboration. Innovation just doesn't come from someone being isolated. It comes from interaction. And I think if we're going to move our systems forward, we're going to need each other. We know so much more today than ever before. And it's not only the fact that we need to continue to gain greater knowledge, but we also need to really be focused on doing what we know. And I think we can most effectively do what we know and innovate through community and collaboration. I think I learned early on to listen to consumers, listen to people and families, and early on, while consumers and families may have different needs, I learned that to come up with viable solutions, the professional can't do it on their own. We need to be informed in terms of what's relevant to the individual, and we need to also help the individual take over their own care. Recovery, I guess the concept of recovery is what I would point to as an example that I think has evolved through community. Recovery was learning the fact that, and I do call recovery the gift of the drug and alcohol field of the mental health field, because they talked about recovery for years, and it involved peer support, the first peer support models when you think about it. And we gained so much from the work of Bill Anthony back in the 1990s when he began to shape the idea of recovery, and the way recovery has been taken by so many people in the community and evolved toward today. Recovery is about one managing one's illness to manage their life, and I think that concept of recovery could only evolve in the context of all those parties working together. If I was to choose one thing, and there are many, so I would say we shouldn't only work on one thing, we should be doing several things concurrently. But if I was to choose one thing, I think from a public policy standpoint, we need to think about how we are purchasing services. And healthcare reform, of course, is having everybody rethink that and think that through. But how do we purchase services in an effective way that yield outcomes in people's lives? Right now we have fee-for-service, we have other sorts of mechanisms which focus more and more on producing widgets of service, if you will, or producing units of service. And we need to evolve from a public policy standpoint, and this will impact the private sector pay as well, methods and mechanisms that incent providers to do the evidence-based. I mean, people talk about that gap of, going back to what we need to do what we know, a 15 to 17 year gap between discoveries and research of what works in treatment before they become more commonplace in intervention. A lot of that has to do with the payment systems not being aligned, and we need to focus on that, re-engineering how we train professionals. So I think how the system touches the person through how services are purchased would be, if I was to name one public priority, public policy priority.